Good day everyone, my name is Vicky Wong Lee Fong. Today, our group will be diving into one of the most fascinating part of the ocular anatomy. It is the extraocular muscle, or EOMs. These are the muscles that control the movement of the eyeball and allow us to perform essential vision tasks such as reading, tracking motion, and shifting our gaze that allow precise, coordinated eye movement in multiple directions. They help maintain binocular vision, allowing both eyes to focus on a single object. Understanding anatomy and function is crucial in both clinical and examination and diagnosis of ocular mobility disorder, because any weakness or misalignment can result in conditions like diplopia, ptosis, or strabismus. Extraocular muscles are a group of 7 skeletal muscles located within the orbit, the bony cavity that houses the eyes. Out of these 7 muscles, 6 are responsible for moving the eyeball in different directions, and 1 control eyelid movement. The 6 muscles that control eye movement are 4 rectus and 2 oblique muscles. They are medial rectus, lateral rectus, superior rectus, inferior rectus, superior oblique, and inferior oblique. These muscles work in a highly coordinated manner to allow the eye to move up, down, inward, outward, and rotation. This precise control is essential for maintaining binocular vision and for activities like reading, tracking moving objects, or scanning the environment. In addition to these 6, there is a 7th muscle called the levator pupillary superior. This muscle does not move the eyeball. Instead, it elevates the upper eyelid, allowing us to open our eyes and keep them open comfortably. All these muscles are anchored at one end to the bone of the orbit, and the other end insert into the scala of the eyeball. In the previous slide, we talked about the 7th muscle, which is levator pupillary superioris, or LPS. Now, let us dive into this. While LPS does not move the eyeball itself, but it plays a wider role in eye function by controlling eyelid elevation. It originates from the lesser wing of the phonoid bone just above the optic canal. It's inserted into the skin of the upper eyelid and also into the superior tarsal plate, which gives structure to the lid. The main job is to elevate the upper eyelid, allowing us to open our eye. Without it, we will struggle to keep our eye open. It lies above the superior rectus muscle and runs forward into the eyelid. It is innervated by the superior division of cranial nerve 3. The cranial nerve 3 is oculomotor nerve. Damage to this muscle can cause ptosis or dripping of the upper eyelid, which we commonly see in oculomotor nerve palsy. The levator pupillary superioris is responsible for eyelid elevation and is supplied by CN3. In the next slide, we will look at each of these muscles in more detail, their action, nerve supply, and how they contribute to the eye movement. Over to you, Aiman.
Good day everyone. My name is Aiman Daniel. Today I'm going to briefly explain the 6 extraocular muscles that help move our eyeball. The muscle let our eyes move up, down, left, right, and even rotate, so we can focus, follow object, and see clearly. Let's go through them one by one. Medial rectus, located on the inner nasal side of the eyes. Move the eyes inward toward the nose, called adduction. If fixed, the eyes can drift outward. This is called extropia. Lateral rectus, located on the outer temporal side. Move the eyes outward away from nose, called abduction. Superior rectus, located on top of the eyes. Move the eyes upward. Also help with inward rotation, intrusion, and slight inward movement. Adduction. Inferior rectus, located below the eyes. Move the eyes downward. Also help with outward rotation, extrusion, and slight inward. Superior oblique goes through a pulley called the trochlea before touching to the eyes. Main action is inward rotation intrusion. Also help with looking down and out. Controlled by cranial nerve 6. Okay, inferior oblique start from the front of the eyes area near the tear duct. Main action is inward rotation extrusion, also help with looking up and out. Let's talk about annulus of Zinn. This is a ring made of the strong tissue found deep inside eye socket. Ring at the back and also called the common tendinous ring. It acts as the starting point for 4 of the 6 eye muscle that help move the eyeball. Superior rectus, inferior rectus, medial rectus, lateral rectus. The muzzle being from the ring and attached to the eyeball to control eye movement. The annulus of Zinn also surround to important opening the optic canal and part of the superior orbital spheres. These are like tunnel that allow important nerve and blood vessel to enter the orbit. Okay, the nerve that pass through or near this ring include optic nerve, bring vision from the eyes to brain. Oculomotor nerve, control most eye muscle. Abducent nerve, control the lateral rectus muscle. Nasally nerve, give feeling to part of the eyes. Okay, now let's talk about the other two extraocular muscle, the superior oblique and inferior oblique. These muscles are different from the rectus group. Okay, superior oblique, this muscle does not come from the annulus of Zinn. It starts just above it, from the supinian bone. It passes through a small lobe called the trochlea, which acts like a pulley. After the trochlea, it inserts into the top outer part of the eyeball. Its main action is to rotate the eyes inward, intrusion, and it also help move the eye downward and outward. Okay, inferior oblique. This is the only extraocular muscle that start from the front part of the orbit, near the tear duct. Nasolacrimal duct is run underneath and attached to the lower outer part of the eyeball. Okay, it help with outward rotation, extrusion, and also move the eye upward and outward. What this is important? Okay, this oblique muscle don't come from the annulus of Zinn. So, they pull the eyes in different direction compared to the rectus muscle.
My name is Ilham Selvan. Now let's talk about where the extraocular muscles are positioned in the orbit and how they attach to the eye. Rectus muscle, the 4 rectus muscles that is the superior, inferior, medial, and lateral rectus, all come from the back of the orbit or point called annulus of Zinn. They move forward in straight lines and attach to the front part of the eyeball just before the middle part, which we call equator of the globe. Because they attach in front of the equator, they move the eyes mostly up and down, left or right. Oblique muscle, the superior and inferior oblique muscle are different. They attach to the back part of the eyeball, which is behind the equator. This gives them a slanted angle which helps with rotating the eyes as well as up-down movement in certain direction. Superior oblique, the superior oblique starts near the back of the orbit but then passes through a small lobe called tortilla found in the upper inner corner of the orbit. After tortilla, it changes direction and runs backward, attached to the top of the eyeball. This let it turn eye inward and downward, especially when the eye looking toward the nose. Inferior oblique, the inferior oblique is special because it's only muscle that start at the front of the orbit near the ear duct area. It runs underneath the eyeball and attached to the lower outer side. It helps to turn the eye outward and up, especially when the eye is turned inward. In summary, rectus muscle attached in front of the eyelid middle and move the eye straight. Oblique muscle attached behind the middle and help rotate and move the eye in diagonal direction. Superior oblique used as a pulley system. The dorsal and inferior oblique start from the front of the orbit. And now let's look at the facial structure that surrounded and support the eyeball and extraocular muscle. These are special connective tissue that help protect, support, and guide movement within orbit. Tenon capsule. Tenon capsule is a thin protective sheet that surrounds most of the eyeball, sitting between the sclera and the fat of the orbit. Think of it like a sock around the eyeball. It allows the eye move freely while keeping it in place. These capsule help reduce friction as the eye moves in direction. Dorsala. The dorsala is a small loop made of cartilage located in the upper inner corner of the orbit. It acts like a pulley of the superior oblique muscle. The muscle passes through the dorsala and change direction, which helps the eye move down and in without dorsala. Superior oblique wouldn't work properly. Lockdown ligament. Lockdown ligament is a supportive sling located at the bottom of the orbit. It holds up the eyeball from below and prevent from sinking downward. It's sometimes called hammock of the eye. This structure is important, keeping eyeball in stable position. Intermuscular speta. Intermuscular speta are connective tissue bands that link the four rectus muscle together. They help to stabilize the muscle and keep the orbit organized. These speta make sure the eye moves smoothly and stay aligned. This facial structure may seem small, but they play a huge role supporting eye movement stability and positioning. Blood supply to extraocular muscle. Now let's look at the extraocular muscle, or EOMS, receive their blood supply now drained from the orbit. Just like all in the body, the EOMS need a constant supply of oxygen and nutrition to work properly. That's where the blood vessel come in. Arterial supply. The main artery that supplies the extraocular muscle is the ophthalmic artery, which is a branch of internal carotid artery. From the ophthalmic artery, a small muscular branch supply blood directly to the rectus muscle, oblique muscle, and even the levator palmebra superior. In addition, each of the four rectus muscle give rise to small arteries called the anterior ciliary arteries. These vessels help supply blood not only the muscle but also the part of the sclera and conjunctiva, which are layers of the eyes. Venous drainage. Once the muscle has used the oxygen, the deoxygenated blood need to be carried away. This is done by two main veins, the superior ophthalmic vein and the inferior ophthalmic vein. These veins collect blood from the muscle and other part of the orbit, eventually drain into cavernous sinus, which is located inside the skull. Proper drainage is important because venous congestion in the orbit, such as cases orbital celtius or thrombosis, can cause the pain, swelling, and eye movement problems. This blood flow keep the eye muscle healthy and functioning, which is essential for the eye movement. Alright, thank you guys.
To conclude our presentation, here a quick summary of a key point. There are 6 muscles that move the eyeball, and 1 muscle, the levator palpebrae superioris, that lift the upper eyelid. The 4 rectus muscles all arise from a structure called the common tendinous ring, also known as annulus of zinc. The 2 oblique muscles, superior and inferior oblique, have unique path end attached behind the midpoint of the eyeball, which help the eye rotate. The muscles are controlled by 3 cranial nerves: cranial nerve 3, oculomotor, cranial nerve 4, trochlear, and cranial nerve 5, adducens. The eye and its muscles are also supported by structures like Tenon capsule and Lockwood ligament, and they receive blood from muscular branches of the ophthalmic artery. In short, the extraocular muscles are small, but they play a big role in eye movement, coordination, and vision control. A good understanding of their anatomy, function, and nerve supply is essential for identifying